Welcome to Software Leaders Uncensored with Steve Taplin.
Welcome to Software Leaders Uncensored, where tech leaders drop the filter and just tell it like it is. I'm your host, Steve Taplin, serial technology entrepreneur, a guy who's launched 30 companies. I failed at 20 of those, but I scaled 10 of those to success. And I turned that roller coaster of a ride into my book, Fail Hard, Win Big. And this is where I teach people how you turn failure into your biggest competitive advantage and how custom software played a defining role in every win. Now I'm the CEO of Sonatify Technology. We are a nearshore software engineering firm helping other scale existing engineering teams. And today we have a great guest out of Minneapolis, Sean O'Neill, CTO of Dasion. Sean has been a healthcare industry veteran, an investor, an advisor, now CTO. Sean, welcome.
Well, thank you so much, Steve, for having me on.
You bet. You bet. Sean, walk our listeners through the journey of your career.
Oh my gosh. Well, I started out on the help desk at a tiny company called United Healthcare here in
I think
Minneapolis. Yeah, that was way back when, 95. And yeah, so I've started in the help desk. I've always had like operation roles, built up a number of different practices around SWAT, incident response, command centers, and that type of stuff. It really got attention of my leadership when healthcare.gov ran into problems. I think it's now 12 years ago. That was what I was really known for, was fixing websites having problems. And so I got pulled into part of the tech surge under Optum, leading that role. And that really unlocked actually an executive career. That success that came with the healthcare.gov rescue, I got the reward to become less technical and starting moving. That really was where my career kind of took a different turn, from being a real hands-on guy, fixing systems, running command centers, to taking it to the next level. How can we architect our business for resiliency? How we can architect our teams for resiliency? And that led me ultimately to VP roles within Optum. I ran Optum Health AI. I ran Optum Genomics, and then ultimately left Optum. And now I've struck out on my own. I've got a couple startups in the hopper, and the one I'm really excited to talk about is Dasion.
Cool. And Dasion, you started as an investor and an advisor and then came on as CTO, right?
Yeah. It was crazy. It even went all the way back to when I was running Optum Health AI, and I ran into Professor Wei Gu at a conference in Boston, and she laid out how her models train, and I was blown away. I'd seen it all, done it all, ran extremely large deep learning systems, extremely large language model systems. And what Professor Gu was showing me was absolutely transformative to me. And I'm like, this is it. We're gonna take this to the next level. And so I came in as an advisor initially, putting some of my hard-earned UNH stock into growing Dasion. And then my role changed a few months ago, and I said, this is it. I'm now gonna be full-time on Dasion. I'm taking us to the next level, and took the CTO position this summer.
So tell us more about what Dasion does.
Well, so we're an AI company. Originally, Wei had made her algorithms for the Department of Navy. They had given her a problem that was, at that time, was unsolvable. How you can take a drone and land it on a ship in high seas, in the middle of the worst storm imaginable. How can you land that drone? And it was an unsolvable problem. She came up with a mechanism called geometric unified learning that, for an IT guy like me, it's way over my head. But when, and it's nuts and bolts, it uses nth dimensional mathematics to be able to create these very complex geometric structures that allow very efficient training of models. Now, I'm a healthcare guy, and so we were looking at what her models could do. And at that time, there was a lot of interest in using your voice to diagnose disease, be it depression and anxiety, or even Alzheimer's, dementia, COVID. And her algorithms because they can identify the kind of micro nuances in the way that you talk. Once again, nothing to do with what you're saying, but how you're saying it and using those biomarkers to identify disease. That just really blew me away. How can we
That
use?
I have never heard of anything like that. What stage is the company at? That's really cool.
Yeah.
Is this being used? Is this in testing?
Yeah. So where we're at in our development, we have a number of different training data sets that we've been using to develop our models. And on those training data sets, we're getting extremely high accuracy, like top 90s for accuracy in detecting depression. We got a 99.9% accuracy if we can detect whether you've had a mild traumatic brain injury. So we've been training on these academic data sets while we're starting to pull in real data from the real world so that we can further refine those models and then ultimately get through FDA. Right. That's for everybody in our space. It is a medical device. If you have an algorithm that is going to diagnose disease, it's no different from an FDA standpoint than an MRI, cardiac stent or something like that. Right. And so we have to go through the exact same process in order to prove that our models are as accurate or even more accurate than a human doing the same diagnosis.
Interesting. I haven't heard much about voice biomarkers and detecting diseases from it. Is there a lot out there right now?
There's really not. There's really not. There's a few companies. I won't name any names. It's anybody can do some Googling and find. It's very emergent right now. And a lot of, I would say, our competitors in this space still are using very classic deep learning models that just require massive data sets for training. They're very expensive to build, that once again require extremely large data sets because of the way that the geometric unified learning is able to take multiple dimensions at the same time. I mean, higher order dimensions, 4, 5, 6, 7 degrees of dimensions. We're able to do it much faster than anybody that is currently trying to do it using a classic deep learning model. And once
And
again, it doesn't matter what you're saying. I mean, depression is a really good example, right? Think of your friend.
wait, you're not running this right now as we're talking, are you? I'll have to work on my pitch and what I'm saying here because I don't want you to send me a report of all the diseases I have.
Well, no, you would have to, yeah, we believe in following best practices in human research subjects.
Okay. Okay. Good to know. Now you're involved in another company as well, right?
Yeah,
Diaspocare, am I saying that right?
Diaspocare, correct.
So
Yeah.
tell us about that.
Well, Diaspocare is interesting. You talk about how I got started in this. Even back when I was in college, my specialty was Arabic, and I was completing my school in Tunisia when I met my good friend Jean-Claude from the Ivory Coast. And ultimately, me and Jean-Claude opened some pharmacies in Ivory Coast. We opened these pharmacies, and almost immediately, the diaspora, immigrants that had moved to the United States or Canada or Europe, they were asking us if they could send their money directly to the pharmacy to make sure that it was used as intended. That was new to me. As you mentioned, I'm in Minnesota. I'm a Minnesota guy. I didn't really understand the diaspora and the challenges they face sending money home to take care of a loved one's health. Oftentimes that money will disappear or be used not as intended or spent on substandard care or inauthentic medications. And so we built a payments platform at Diaspocare that allows the diaspora to send the money directly to the pharmacy, to the clinic, to the specialist, to really make sure that it's used as intended.
Gotcha. So you certainly have a lot to keep yourself busy. When you mentioned your partner, Jean-Claude, I was thinking it's not Jean-Claude Van Damme, is it? And
Now,
that's the only Jean-Claude I know. So talk about your software engineering teams at your company and the model you run and how you manage them.
yeah, well, we'll stick with Diaspocare for a second there because that journey, as a startup, as a self-funded startup, it's me and a couple other folks here in the Twin Cities that have been putting our funds into developing Diaspocare, we've always had offshore teams. Originally, we started in India. It was just too challenging with the time zone differences, with a lot of the cultural differences. Initially, we thought there are a lot of Indians, people from India that live in the United States that do the same thing that we're doing in Africa. But we just found a lot of nuances that were from getting the business side to align with the technology team that we really needed to have a team in Africa. And so most of our software development has been done in Nairobi, Kenya. I've also utilized nearshore. I've got a team that I've used for almost 15 years down in Bogota, Colombia. Once again, I can get more inexpensive engineers, and the team in Bogota, obviously they're in the same time zone as I am here in the central US. And then the team in Nairobi, really super critical that we had our developers that are sitting right across from the bank that we use for our payment gateway. And if there's a challenge, they can literally just walk across the street, hammer it out in real time at the bank. And that's just absolutely invaluable.
Now, are there a lot of software engineers? I don't hear about Africa much for software engineering talent. In
Yeah.
specific, you mentioned Nairobi. How did you stumble upon that?
Well, you're right. It's not, I would definitely say historically, not thought of as being a place to get software development done in Africa. The educational systems are in many countries, especially we do a lot of stuff in Ghana, Nigeria, Kenya. And Kenya, I can't say enough nice things about the quality of the software engineers that we're able to get. Plus, because they're using the digital payments, as I described earlier, Diaspocare is all about these digital payments. And that's the world in Africa. Everything's digital already. In many ways, they're even more advanced than what I see in the United States. And so finding engineers that have a good, solid educational background, that understand kind of the boots on the ground experience with respect to our customers and our business partners, it's been great. And from a expenditure standpoint, they're cheaper than getting a US based software developer.
So it's the whole challenges of working with offshore and aligning business and technical needs. That, as I've been, and I am not a software developer, but I've been building software for all of my companies for the past 25 years. I hit an inflection point where the offshore resources, um, it became too difficult as cloud and mobile technologies became more complex. When it wasn't a matter of just having an hour overlap and a team can work. That was why I actually started my current company, Sonatify Technology, in 2020, was to have same time zone resources throughout Latin America. That whole industry in Latin America and software really kind of was just born as of like 2016 was when it really took off. And that same time zone, closer cultural alignment, I found was key, when your business can't afford to pay all US based prices.
Yeah. And to pivot over to Dasion, we've done a ton of software development based out of Costa Rica.
Okay.
And so we had a Costa Rican team that, exactly as you're saying, Steve, I mean, the same time zone as me, English not being a problem whatsoever. We never had a communication challenge, and really top-notch engineers to build a rather complex system for Dasion. I mentioned earlier about the voice, using your voice to diagnose disease. My vision is to have somebody be able to call a phone number, talk to a voice avatar, and in 60 seconds, I'll tell them if they have diabetes or not. And so
How far away do you think we are from that? What's your guess?
we're really damn close. This time next year, I'll have FDA certification, and then
Very nice. So the technology is that far along to diagnose multiple diseases.
yeah.
And it's just a matter of getting over that final hurdle.
And so from a technology standpoint, we needed to build a system where I want to have 1 million people call in, right? And so I've used Twilio quite a lot, in different call center apps that I built during my time at Optum. And so I dusted off some of those old brain cells, worked with that team down in Costa Rica, and we built the infrastructure for a highly performant, high throughput, high volume call center that can sit below our avatar that will interact with the consumer to be able to diagnose their diseases.
Cutting edge stuff you're working on. This is fantastic. Now, when you hire software engineers, what are key traits you look for?
I'm probably non-traditional, would probably be the understatement, because over my entire career, 28 years, I've built a lot of teams, probably more so in operations than on the software development side. But the concept that I would unify across all of that is really what are the personal characteristics of that individual, almost like irrespective of education. I mean, obviously education is important, but real world experiences. What have you done that was hard? So a great example, especially when I was building teams earlier on, I hired a lot of veterans. Even if they didn't have a 4-year degree, that's a population that it, because of their training, because of their military training, because of their experience, they really know how to perform well under pressure. They know how to think creatively in a pinch, and very respectful and professional when you're talking with executives. Many veterans for their whole career might be talking to officers or other higher ups, and so business communication also comes rather naturally. But very similarly, one of my best engineers I ever had was a repo man before he joined my team. So he stole cars for a living and got
Legally.
paid.
Okay.
Talk about somebody that can think on their feet. Talk about somebody that can come up with a novel solution to a problem under pressure. That's a repo man.
Well, you definitely have taken a non traditional approach to finding good software engineering talent.
But but empathy. I mean, I'm just going to jump into the most important thing to me is empathy.
And that's before or after their ability to steal cars.
Well, you stumped me on that one. I don't know if I have a good example.
Well, let's keep going, Sean. So, as a tech leader, here as we're almost in Q4 of 2025, what are some of the biggest challenges you're facing now?
Yeah. So on the Dasion side, it is bringing in training data. It's, as I had mentioned, we've done all of our model design on academic data sets that we have access to. And that next level is bringing in real clinical data. Ironically, this is where a lot of things are coming together. My Diaspocare business delivering healthcare, and we moved from just working on payment system to now care coordination, diagnostic kiosks, enablement in clinics. That will allow us to get a training data set that in Dasion we can use and access to those training data sets, because it doesn't matter what language they're speaking. If you are a Homo sapien, I will diagnose your disease using our methodology, irrespective of what language you're speaking. So we're right now, between now and the end of the year, we're harvesting a lot of data from those partnerships that we've developed in Africa so that we can train our voice biomarker detection algorithms. So
So,
a lot of things coming together between the two companies right now.
with multiple healthcare startups here, how are you guys going about funding?
Well, funding. So on the Dasion side, even going back to the beginning where Professor Wei Gu is working with the Department of Navy, we've gotten quite a bit of funding from the National Science Foundation. NSF money in 2025 it's really challenging. Previous to 2025, we were able to get access to NSF funds a little bit easier than we are now. But that pressure is really upping our game, making sure that we're really delivering to the American people, because the NSF funds come from the federal government, that we're delivering really life-changing technology that will benefit all Americans and ultimately the world. So we've been getting a lot of funding from the NSF, and then just VC, doing the VC thing that can really make you grow old before your time. But at an early stage company, that's It's kind of the reality. Finding people that are inspired by our mission, inspired on what we're trying to do, and are willing to partner with us to take that leap and make those investments in this type of technology that will benefit them, could benefit their loved one, their mom, their sister, their own children one day.
And VCs can be pretty brutal in 2025 as far as getting their money and the valuations that you get. And I'm guessing you had a full head of hair before you started talking to the VCs.
Oh gosh. Yeah, it's tough. It's tough. And even in an AI world where that's all you hear about right now is AI, I'm going to throw billions of dollars in AI. The reality is still pretty tough. Sound business fundamentals about market penetration, product market fit. Can you demonstrate that you can get revenue out of your product? It doesn't matter if you have an amazing technology. The VCs they're business people, and they want you to prove that they're going to get a return on your investment. It's tough right now. You're right, Steve.
It's definitely a challenging environment.
It's up in our game. So bring it on, baby.
So, Sean, you mentioned 28-year career. What have been some brutal lessons that you wish you would have learned earlier in your career?
Oh man. I guess it's really focus on a more narrow objective in your business and get that over the finish line. I feel that unfortunately, time and time again, I've taken more of like a command center approach, right? In the early part of my career, responding to a portal that's down, and you'll try one thing and try another, try another, try another. In business, that you can burn through a lot of cash. And I do wish I had learned that earlier. When I look at both Diaspocare and Dasion, we've placed bets on different business opportunities, and we spread our chips too thin. And then at the end of the day, you're not getting a success. And that's the message that we keep getting back from the VC community, which is, that's great that you got 10 different ideas. You got to show me one. You got to show me one over the finish line, and then we'll invest. And I wish I would have learned that earlier.
You know that when you hear about all the AI failures and negative return on investments on AI projects, it's often because companies are not choosing the right case studies for it, and they're taking it 90% of the way there, and then that last 10% is really tough and they quit.
Yeah. It's that hockey stick like this, like all things that are extremely difficult. When it gets hard, it's going to get really, really, really hard. And especially with model refinement, I'm thinking like our diabetes voice biomarkers. We start out in the mid 80s, and that's, fantastic. An 80% accuracy of detecting whether or not you have diabetes. To move from like 80 to 85 is a massive sea change. 85 to 90, exponential, 90 to 95. And that's really where I feel, just like you're saying, Steve, that companies just throw up their hands. You've got to be creative and look at those failures, not so much as failures, and say, I need to learn from what I've just done, plow that learning back in. And maybe that means that I have to rethink everything and start over again. But you're not going to know what you need to do next until you freaking try.
I love it. Sean, thank you so much for getting uncensored with us today. Excited to see where you take these companies, this technology. I'm going to hold it to you that in a year from now, you'll have full FDA approval for all of it. I love it. Sean, before we wrap, what's some no BS advice you have for tech leaders out there trying to build, scale, or just survive in today's environment?
Oh my gosh, the no BS. It's don't take the BS. I've been a CTO at a couple of different companies, and I sometimes will give my technology team a little bit too much wiggle room and not hold them to account. And you have to, as a leader, that is your effing job. If someone says they're going to do something, you got to hold them to it. And if they don't, especially if they don't repeatedly, they need to find something else to do with their career, and it's not going to be at your company. So you got to be tough. You got to be tough.
I like it. Sean, thank you so much. That's it for this episode of Software Leaders Uncensored. I'm Steve Taplin. If you enjoyed the show, go ahead and hit subscribe. If you didn't enjoy it, well, we're just going to share it with your competitors. They could probably use the edge. Remember to fail hard, win big, and always build what matters. See you next time.
That's a wrap. Another great episode of Software Leaders Uncensored. Thank you guys so much for listening. I really appreciate it. It's a lot of fun doing this show. I love talking with great tech leaders. As a side note, if you're interested, check out my new book, Fail Hard, Win Big. This is the story of how I built 30 companies, failed on 20, and turned 10 into multi-million-dollar wins. The common thread with all of them was custom software. Also, if you need software development help out there, my company, Sonatify Technology, we deliver world-class software development engineers out of Latin America. We have a solid track record of helping companies launch better products and faster. Thanks again for listening. Appreciate it and appreciate you.